This is definitely not the best of times to fall ill in Benue State, north-central Nigeria. And the reason will certainly send chills down your spine. Health workers have been on strike for almost a year now. It began on January the 11th this year when doctors with the Benue State Hospitals Management Board embarked on an indefinite industrial action for non-implementation of the Consolidated Medical Salary Structure, CONMES, approved by the Nigerian Medical Association for all medical doctors. A few months later, other health workers, including pharmacists, nurses and laboratory attendants, joined in the strike action.
Sometime in December of 2010, the leadership and in fact all Nigerian doctors met in Abuja and directed that every doctor in the Federation, irrespective of tier of practice, should be paid based on the unified structure, the CONMES structure. Most states have adopted this. Unfortunately, as we speak now, Benue is yet to adopt. That is why the hospitals have been closed.
Since the work stoppage, the government hospitals in Makurdi and all the local government areas have been under lock and key, and dust and cobwebs have taken over all the wards in the hospitals. The skeletal services rendered at the state hospital in Makurdi were provided by a non-governmental organization, Center for Integrated Health Program for AIDS Victims, and other humanitarian services.
If you see outside, you see some people accessing drugs, being attended to by some personnel. Most of the personnel you're going to find there, they are consultants being employed by the NGO CIHP. It's an American NGO. They are the ones working. But in our little way, we try to assist to make sure things go well.
The pressure on privately owned hospitals is enormous as citizens resort to either attending the Federal Medical Center or private hospitals, and in most cases seek alternative medication through traditional medicine.
There have been a very serious effect on the private hospitals, most especially the workload increased right away from that time. It has taken a long time now. We have actually the Federal Medical Center, which is federal, but the state hospitals, which are the general hospitals, whereby the poor people can easily reach, they have been closed for a long time, and the people in most especially in rural areas are suffering. It takes a lot of time before they can get vehicle that will convey them to the nearest functioning private hospitals.
We are suffering, especially we poor people. We have no money to go to private hospital, and we are suffering. If you see me here now, as I'm here now, I'm in problem here. You see, I have no person to help me. I go to private, the money they charge me is too much, and I don't know the reason why government is neglecting their own demand. It is high time they listen to their demand and answer them, because actually health is wealth. You see, if we all die in this country, who are the leaders going to lead? You see, okay, this money they are using it in nonsense places. We don't. This place, particularly health, you see, is very, very important to us.
Especially we take the orthodox medicine. That's what we rely on, because if we don't have money to go to private hospital, go to this traditional practitioner, this is their medicine, what they cook along the street, they give us, we take, and that is what is helping us, because we don't have money to go to private hospital.
In all these, the Benue State government argues that the salary structure is solely for medical doctors employed by the federal government. All such information was not forwarded to the state governments by the Salaries and Wages Commission. The head of service explained that no communication was established between the government and the Salaries and Wages Commission or the medical doctors in the state before the industrial action. As negotiations continue between the health workers and government, all arguments must put the citizens into consideration, as the majority of the populace cannot afford the privately owned hospitals. Hence, the need to urgently resolve the matter for the hospitals to spring back to life and attend to patients.